I work at the headache and facial pain section for the Center for Neurologic Restoration here at Cleveland Clinic. There I see mainly patients with migraine, but with other rare headache syndromes as well, trigeminal autonomic cephalalgias, cluster headache, and of course trigeminal neuralgia as well. Headache and facial pain is fascinating. I think there's nothing cooler than the brain, but I see mainly young patients who are really motivated to go back to work, back to school, and really we can make a large slew of difference in their lives. We have a large toolbox of medications, non-pharmacologic options, infusions, therapies, and procedures, and really to me that motivates me the most to really optimize a patient's quality of life, really get them back to functioning and doing what they want to do. I think it's really important to establish goals with the patient, figure out what are they looking for in this visit. After that, we do a deep dive into understanding when did the headache or the facial pain first begin, how has it evolved, what does it feel like, and most importantly, how does it affect a patient in their life. We also talk a bit about previous treatments, whether that be over-the-counter, oils, other therapeutics that the patients have tried before. And then after that, we do a complete neurologic physical exam in the office. And after that, of course, there's a large collaborative and comprehensive approach into discussing, well, how are we going to tackle this issue for the patient? And I usually start with this disclosure, that I can be as aggressive or as conservative as a patient would like. We do get a lot of second, third opinions from outside in the community and even outside the state for both diagnosis and for treatment options, surgical planning, further diagnostic imaging. So I think it's probably a mixed bag of everything, and we're lucky to be able to cater to our own local community, but also see a lot of patients referred by their general neurologist with more complicated headache syndromes. Outside of medicine, I really like to spend time with my family and friends. My family, my parents and my siblings are all based in Michigan, so I escape there on the weekends most of the time. Here in Cleveland, I like to try new recipes and try new restaurants. I love to walk on Edgewater Beach, and of course, I love to dance outside of here as well.